and welcome to the show today, Healthy Living. I'm Kaylene Cornell, Health Education Coordinator for the Purchase District Health Department. Today we're going to discuss how environmental health plays a large role in our overall health and how it attributes to the health of our community. I have Deborah Payne, who is the Energy and Health Coordinator from the Kentucky Environmental Health. Thank you, Deborah, for coming today. I think this is really exciting because I really don't think the people in our area really understand or think much about, the environmental health. We focus on, because we hear about our counties of where we stand with being healthy, but we never really discuss the environmental health. Could you start off kind of talking about your foundation? And first of all, you drove quite a ways to come here, so.
Thanks. Yes, I work with Kentucky Environmental Foundation, and we work across the state. We're based in central Kentucky, but we're an organization that works to make health a priority in decision making, and particularly as the environment affects our health. The organization was founded about 20 years ago as a community concern around what was going to happen over the disposal of some nerve gas agent left over from World War II. And the community wanted to make sure that it was disposed of in a safe way. The military had intentions of burning it, and the community thought that didn't sound like a safe thing in terms of what would happen to air quality, how would that affect children. And so the organization was founded to work with the community, to work with decision makers and work with leaders to come up with a solution that fit everyone's best interest. And so now, through that conversation, they have started working on a plant that is neutralizing the nerve gas instead of burning it. And so the goal of our organization is to build community dialogue around concerns where many different parts come into play when it comes to air quality and water quality, but certainly when it comes into employment and jobs and a good, healthy, sustainable community. How can we keep all of those things in mind when we're making decisions around health and our environment?
Sure. You really gave that community a voice to make it so much healthier for them.
It certainly did. And one of the most important things is that we, in a very nonpartisan way, in a very collective way, found good, healthy solutions involved. Senator Mitch McConnell was very helpful in helping us find funding for this project, and we were very grateful for that. But it also allowed the community to have a voice, business leaders, health professionals, parents, mothers and fathers that were concerned about their young children, and created a good space where people can have a conversation about a tough situation.
Sure. When you talk about environmental health, how would you define it? What exactly is
Certainly.
that?
I think frequently when we think about health, we're thinking about when we go to the doctor, we want to make sure that we're addressing our diabetes, we're taking our medicine, we're watching what we're eating. Or if we go to the doctor because we're concerned about the flu, we might take medicine to help prevent spreading the flu. When we're thinking about environmental health, it's a totally different concept in that it's the big picture. We're looking at things that can affect our health on a larger scale. It's not just treating the disease. It's creating prevention, or putting prevention as the primary interest. So we're looking at ways to make sure that air is clean and water is clean so that you don't end up having to go to the doctor as much for asthma, for example. We know that air pollution can cause heart attacks and strokes. So how can we improve air quality so that we don't have to end up treating conditions that can be very, very life-threatening?
Sure, yeah. So, air quality, you can see how that would connect with respiratory, like you mentioned, asthma. How would it impact is it more the pollen, or what are we looking at when we're talking air quality for that?
Sure. So environmental health is basically anything in your environment that can affect your health. And certainly when we have our pollen alert days, that's a part of environmental health. You know that if there's a lot of pollen, then you need to make sure that you're prepared for that if you're asthmatic. Maybe you make sure you got your inhaler on you. When we're thinking about the the broader things in our community that can cause air trigger. We know that car emissions can trigger asthma. We know that industries that put out a lot of emissions can trigger asthma. So environmental health is looking at the big picture and figuring out ways that we can address air pollution or address environmental triggers so that we can minimize health impacts on the population.
Mm-hmm. Does it matter if it's rural versus city? I mean, do you see a huge difference? Or, because you always think, oh, air out in the country, it's so much healthier. But I mean, we have industries and we have, cars and other things too. So
certainly, different environments are going to be cause different types of exposure. So it just depends on where you are. If you're living along an interstate, you might have higher levels of emissions from cars coming down the road. If you live in an industrial area, you'll certainly have higher levels of emissions from those industries. So it all depends on what your exposure is, and not everyone is affected in the same way. It's important to pay attention to specific populations like the young and the elderly. Those populations tend to be affected by air quality in a much more intense way.
Sure. Well, besides asthma, we have the other elements that attribute to our health. Nutrition, physical activity. How can environmental health impact those?
Mm-hmm. The environment in which you live in certainly affects your health. So if you have a good place to get out and walk, that'll certainly help you improve your respiratory health. You're getting out and you're feeling good because you're getting a walk. So certainly the environment in which we live affects our health. And if we're able to maybe walk to the farmer's market, that's much healthier than if we don't have a way to walk to the store and don't have a grocery store that's nearby that has good fruits and vegetables. So all of our environment can affect our health, whether it be the air that we're breathing or the access that we have to a good, safe place to walk or the water that we have to drink. Everything in your environment can ultimately affect your overall physical health.
Mm-hmm. Okay. How do you see it as how it affects healthcare?
Well, in terms of healthcare, when you have a good, healthy environment, then it can ultimately there's less need for the kinds of healthcare that you would have to keep yourself going. Certainly, you want to keep going to the doctor and get checkups, but if you're able to do the things that help improve your health without having to, if you're doing like getting out and walking and getting fresh air on a routine basis, that certainly is good medicine. Sure. As opposed to having to take other medicines.
It all fits into prevention.
It all fits into prevention. Public health is all about prevention.
Right. Now I know you were able to get the health impact assessment, which was a grant, and it really is quite impressive to be able to achieve it for this area. Could you describe what that is? And
certainly. So we're very excited and very honored to receive a grant from the Health Impact Project. And this project is funded by, in support by the Robert Wood Johnson Foundation and the Pew Charitable Trusts. And health impact assessments are a tool that are sort of growing in popularity in the United States. They've been used in Europe for quite a number of years, but health impact assessments are tools to help us make decisions around health that in areas that we don't typically think about health. So it's looking at health impact assessments in the environment and in community and industry. It's a really important tool. Health impact assessments are used to help educate a decision or a project or a program that might not necessarily include health in the decision making. For example, if you're going to maybe improve your transit system in town, you might see how the health may be affected if you're going to set up a new bus system, making sure that you're accessing certain communities that would otherwise not have access to transit would be something to pay attention to. It might look at the orientation of a building. If you set up a hospital, or there was one example of a retirement facility. If you orient the retirement facility so that people can walk in and out of walk to the retirement facility, or that you have the air system set up so that it's not right against an interstate, so that you're not drawing in air pollution into the facility. It's making considerations where you might not have taken that one step to think about how health can be considered. So the health impact assessments, this is the project that we were funded for, is basically being used as a case study to demonstrate that health impact assessments are really valuable tools, and to learn more about how we can use them in the United States as these valuable tools. Our health impact assessment is looking at decision making around the Shawnee fossil plant, the TV's Shawnee fossil plant, and how that can affect the community in terms of the future of the plant, and meeting new air quality standards, and making sure that jobs and all of that are taken into consideration, so that the community can be vibrant, the air and water are clean and healthy, and the best decisions can be made about this type of industry.
Okay, so what kind of issues would you see come out of this?
So I'll take one step back and talk about the fact that health impact assessments are, while our organization is conducting the health impact assessment, really the input from the community is what is the most important step. It goes through a 5-step process where you're doing screening and you decide if it's a good project. Scoping then defines how much you want to be looking at with the project. Then you do an assessment, and then recommendations are formed, and then there's a process of monitoring to make sure those recommendations are implemented. But with this particular health impact assessment, we're seeking input from community members, from health professionals, from industry representatives, from community leaders, anyone that might have a stake or an opinion or feelings about this particular decision-making process. And then once we gather information from the entire community, or as many people as we can gain input from, the recommendations are then made by the community and then presented to decision makers. So when we're addressing the future of the Shawnee fossil plant, we're looking at the plan is making considerations about how to address air emission standards, or if the plant is facing future transitions, what does that mean for employment, and making sure that everyone has a good job in the future as well.
What are some things you've done so far then?
So far we've had a training. We have some partners that have come and worked with us and did a training with community members on what health impact assessments are. So we've learned about the process, and we've started having conversations in the community, gaining input on what people are concerned about. So certainly making sure that we keep good, healthy jobs in the community has been one big concern. Making sure that air and water quality is safe have been other concerns. And so we've had lots of good conversations. Once we have everyone's input that we're able to make contact with, then we'll seek their input on what they think is the best step forward to make recommendations around this plant. And so once these recommendations are pulled together, we then present it to the Tennessee Valley Authority, and because they have a stakeholder process where you can provide input on your concerns. And then we'll make other recommendations to other community leaders about making sure that we have vibrant jobs in the community, or that if there's a concern about air quality, how can we make sure that people are getting checkups and making sure that they're staying healthy in the community and continue to have good access to good clean water and these kinds of things.
What kind of avenues have you used to get input from the community?
So we've had some listening circles And so that's been important, where we've gone and invited community members. We've invited people via the radio and put out press releases. We've gone door to door and sought input that way. You are have helped coordinate a health survey that has been beneficial, so we'll learn more about that and see what the results of that survey are, what the community values in terms of their health. And so it's doing a cross-section of input that way. We'll also have an economic analysis that an outside company will do and look at how jobs in the community are affected when transitions happen. So that we'll have that input as well.
Okay, all right. So it like you said, by taking a business decision and adding the health perspective to it, to help them make a better decision. What are you said that quite a few have been done in Europe, but it's new to the United States. How many have been done in the United States?
Well, by the summary that the the Health Impact Project has calculated, there's about 50 to 70, I think, that have been done across the U.S. And it's growing. About 5 years ago, there were maybe 10 or 15. And so people are finding this to be a very helpful tool. We have, as a part of the legal process of building a new building or building a new road or something, we have environmental impact assessments. So we know that we're making sure that we're not eliminating endangered species, or we're not affecting a waterway. In that same way, a health impact assessment is making sure that we're making good decisions so that we're not affecting health. We're minimizing our impacts on health and looking for the best health outcomes.
Sure.
So.
Yeah, well, you can tell, some in the past. Do you want to share what some in the past have done, of what they have kind of accomplished with some of theirs?
Well, one example that just came to mind was one that was done up in Alaska, and there was the construction of a new pipeline for, I believe it was natural gas. And there was concern about the impact that might have on traditional cultures and their access to food, because these were folks that still hunted for their food and wanted to make sure that if they put in a pipeline, that wouldn't interrupt the flow of the movement of caribou. And so one decision was made. It didn't stop the process. It basically made sure that health was included. And so rather than having a pipeline that ran along the ground, they raised the pipeline 15 feet up into the air so that it wouldn't affect the movement of caribou underneath the pipe. So basically making sure that people still had access to their natural food source.
Sure.
It's a very interesting solution to something that you might not have otherwise thought of.
Right, yeah. Well, once again, having the community, a part of it, and you're living there, and you want to be able to have some. Maybe we don't have the deciding choice, but have some input, and really helps.
Certainly.
And same thing with this project, just having some input on, would you say this covers more the air quality, or what would you be looking at more with this project?
Well, I think the important thing about this project is that it covers the wide range of things that affect health. We frequently think of health as being, we make sure that we're eating good fruits and vegetables, or we're making sure that we go to the doctor. But health impact assessments use the broader concept of a health. That if you don't have access to income, then you can't have a good place to live. If you don't have a good job with health insurance, then you're not going to be going to the doctor to prevent diseases that you might otherwise, have. So when we're talking about health, we want to look at the whole picture. We want to look at air quality and water quality, but we also want to look at jobs and health insurance and how that affects the income in the community. So all of those things are part of the big picture, and each part we can't ignore any part of it without addressing the other parts. So there's some give and take in the process, but certainly the recommendations come from the community come from the values of the input of people that have participated. And it's a very inclusive process, and it only comes out of recommendations from the community. So the more people we can involve, and the more people that we have in this process, the stronger the value of the recommendations.
Sure, yeah. How, as we talk about community members, more specifically, how can the professional or business people, how do they play a part in this?
Certainly. So if you're interested in having, say a business person who provides some kind of service to the TVA, to the Shawnee plant, you'd want to make sure that if TVA doesn't need your service anymore, then you'd want to make sure there was another business in your community that did need your service. So how can we make recommendations to make sure that those gaps are filled, to make sure that we have ways to create good businesses when other places maybe fall short. For example, maybe if you're a teacher and you're concerned about where your income for your school is going to be coming from, you want to make sure that you have a good tax base to make sure that you have consistent funding for your school. Maybe you're a parent that's concerned about your child with asthma. You want to make sure that if there's decisions about how to meet air emission standards, that you're going to have the best air quality available for your child that has asthma, to make sure that they can breathe healthy air. So those are all, all valuable things.
Sure, yeah, okay. Well, if someone, hears about this, how can they get involved? Or
Well, we have a website called, it's on Facebook, and it's a Shawnee HIA Health Impact Assessment, and I'm not remembering the exact address, but if you look for the Shawnee Health Impact Assessment on Facebook, you'll be able to find it. You can also contact our organization. You can contact me at deborah@kyenvironmentalfoundation.org, or you can give us a call. And our webpage is www.kyenvironmentalfoundation.org, and you'll be able to find a lot more of that information about this particular project, and you can contact us that way.
Okay. Where are you at with the project? And by the way, they could also call the health department too, and we'd be able to get them, in touch with you too. And we have our number on the screen there, so absolutely, they could call us too. Where do you see? How long would this project take, do you think?
So right now we're in the scoping phase, where we're defining what we want to be looking at. We've been getting input from community on what their concerns are. So we know that we want to be looking at economics. We know we want to be looking at air and water quality. We know that we want to be looking at how taxes affect the community. And so we're in the scoping phase. We're sort of in the second part of the process, and we hope to wrap that up pretty soon. And then we'll begin the assessment phase. So we're approaching the middle of the process, where we assess all of the data and the information that we've brought in, and then later on in the fall we'll be looking at making recommendations.
Okay.
So,
all right. So there's still time if anyone would be interested. They definitely could have some good input with this.
Exactly. We're looking for input through the entire process. This is while our organization is conducting the project, it is ultimately the input of the community that defines the project. So input at any stage in the process is really valuable, and certainly the follow-up to make sure that the recommendations that are made are that there's follow-through to make sure that these recommendations actually become implemented. They're certainly not a mandate; they're just recommendations. But the hope is that health will become more important in our decision-making process, and that we can think about health in a new way, especially environmental health.
Yeah. Now, how has TVA been open to working with the project?
We have a good working relationship with the TVA. They've been providing us with information, and we have been very open in sharing all the information that we're gathering and letting them know where we're at in the process. We are looking forward to getting a tour of the facility and learning more about how the Shawnee Fossil Plant operates. And so we'll have community members that can come and ask questions at the plant and learn more about what TVA has done to keep their facility up to date and how they operate.
That would be great for anyone to, have an opportunity that maybe is, wondered about it or had concerns, and they would get their questions answered that way.
Exactly. So the whole process is very open. Anyone can ask any questions about any part of the process, and hopefully we'll just keep a good conversation going about how things in our community can ultimately affect our health.
That's great. Good. Well, thank you, Deborah. This has been very informative, and hopefully, people have really gotten some information about it, and if they have, interest or concerns about it, that they would contact you or us at the health department so they could be a part of it.
Yes, we certainly hope that happens.
It is. It's really exciting to be able to have a project for the community, and that's really what it is. The health of the community is what this project's all about. So it's nice, to have that opportunity. So thank you for coming today, and thank you for watching our Healthy Living show today. You can access still our community health survey online, or you can obtain the paper copy at the McCracken County Health Department. So either one would be fine. Thank you again for watching. Have a good day.